A record 738,000 people got vaccinated. An outstanding result, and I want to thank everybody for coming forward to do that. We're up to 5.9 million jabs in New South Wales. I'd set a target of 6 million by the end of the month, and it looks like we'll be at least a week ahead of schedule. So I'm so pleased that everybody's really heard the call, heard the messages, and is coming out to getting vaccinated. We had 160,000 people who got tested in the last 24 hours, another huge number. There were 818 cases of community transmission, with at least 42 of them infectious in the community. 3 people lost their lives overnight. We extend our deepest condolences. All 3 were in their 80s. All 3 had underlying conditions. It was 2 males and 1 female. Again, we extend our deepest sympathies, and Dr. Gale will provide further details of that. I also wanted to stress this morning that we're all going through the roller coaster ride of emotions as case numbers go up and down, and I don't want us to focus so much on the case numbers going up and down. Absolutely we want to see the case numbers go down, no doubt about that, and we're working so hard together to make that possible. But the number we really need to focus on is the vaccination rate. Once we hit 70% double dose, we'll be able to live life more freely, and once we get to 80% double dose, essentially would have normalised the COVID, the way that we treat COVID. As the Doherty report says, once you get to 70% double dose vaccinations, you start to transition and treat COVID as you would the flu in terms of how you record hospitalisations and how you record the way the community is going. And I really want to stress that point. In relation to the 6 million jabs and schools going back, I said that we'd have more to say about that towards the end of this week, and we will. We'll be able to communicate what additional freedom people might have once they get to full vaccination during September, and we'll also outline our plan for schools. And please know both are a work in progress, and we're consulting the Chief Psychiatrist as well as our public health team to make sure we get the right balance. In relation to the suburbs of concern in Greater Western Sydney and South Western Sydney remain the highest generator of the cases, unfortunately. So Marylands, Guildford, Auburn, Greystanes, Greenacre, Bankstown, Blacktown and the surrounding suburbs are the ones of most concern. And in regional New South Wales, as the Deputy Premier will outline, Western New South Wales remains our concern, but there's also a few areas where there's sewage detection of the COVID virus, but yet no cases. So the Deputy Premier will speak about that as well. And I really want to do a call out again to anybody who's between the ages of 16 to 39 in those 12 local government areas of concern. Please come forward and get vaccinated. Just get onto newsouthwales.gov.au to book. And once you book, we expect people to get vaccinated in the same week. So you don't have to wait a long time. It could be within days, even a couple of days or the next day. So please make sure that if you're between 16 and 39, you come forward. You're being given priority for obvious reasons. We're deeply grateful for your understanding and your patience, but please come forward and get vaccinated. Hundreds of thousands in that age group have already booked, but we're keen to see many more in that category. I'm also very pleased to have with us today one of the incredibly hard-working clinicians we have around New South Wales. Dr. Nguyen is here from Nepean Hospital, and she's going to speak about her experiences, but also focus on the importance of vaccination and getting the vaccination rate up. Now, I know what New South Wales is going through now is a difficult time, is a very challenging time, one which I hope none of us have to experience in our lifetimes again. But every state is going to have to go through the transition of going back to normality. And whilst our transition perhaps happened sooner and more starkly than what we had envisaged, every state, once you get to 80% double doses, every state's going to have to live with COVID. And you can't keep Delta out forever. You can't assume there'll be 0 cases, even if you've had 0 cases today. And so I really urge all of us to keep working together in New South Wales and across the nation to make sure we provide health and safety to all of our citizens as much as possible, but also we focus on what life looks like in just weeks and months away. And in fact, New South Wales is doing better than we anticipated in our vaccination rates, and I'm hoping to give updates to the community on when we'll hit the 70% double dose. At this stage, we're still saying the end of October, but there is a chance we'll get there sooner given how quickly people are responding. We're deeply grateful for that. I'll now ask Dr. Gale to give the health update. The Deputy Premier will talk about the regions, and then Dr. Nguyen from Nepean Hospital will give us her update on what it's like working in hospital at the moment and also the importance of vaccination. Thank you.
Thank you very much, Premier, and good morning, everybody. Till 8 p.m. last night, there were 818 locally acquired cases of COVID-19, and there were no overseas cases reported. Again, the New South Wales population came out in record numbers to be tested, and we had approximately 160,000 tests reported, and our team have also been working on clearing a backlog of negative tests, thanks to all the people that have been coming forward for testing, and a big thank you to all our labs as well, both public and private, who've been working so hard to manage that high demand for testing. There are currently 586 COVID cases admitted to hospital. There are 100 people currently in intensive care, of whom 32 require ventilation. Of the 100 cases in ICU, 87 of those people are not vaccinated, and the remainder have had their first dose of vaccine. As the Premier said, we're sad to report today 3 more people who have lost their lives due to COVID-19. They are firstly a man in his 80s from southwestern Sydney who died at Liverpool Hospital, which is also where he acquired his infection. And he's the 11th death linked to the outbreak at the hospital's geriatric ward. He was unvaccinated and also had serious underlying medical conditions. The second person is a man in his 80s from Newcastle who died at John Hunter Hospital, having acquired his infection at the RFBI Hawkins Masonic Village aged care facility in Edgeworth. He had received 2 doses of the COVID-19 vaccine and also had some serious underlying medical conditions. And this gentleman's death is the second linked to an outbreak at that facility. The third sad death is a woman in her 80s from southwestern Sydney who died at Campbelltown Hospital. She'd received 1 dose of vaccine and also had underlying medical conditions. On behalf of New South Wales Health, I extend my deepest sympathies to the families of those individuals who've passed away. As the Premier mentioned, we remain concerned particularly about transmission in the southwestern Sydney and western Sydney area, and again a call on the populations of the following suburbs to please be vigilant for symptoms. Please, like all the population of New South Wales, follow the public health orders and please get vaccinated. And they are people who live in Blacktown and the surrounding suburbs, Marylands, Guildford, Auburn, Greystanes, Greenacre and Bankstown. As the Deputy Premier will talk in more detail, we are also concerned about some sewage detections in Battle Bay, as we have mentioned also in recent days, and I encourage the population there to come out for testing. Similarly, I encourage people who live in Lithgow or have been in the Lithgow area to please come forward for testing. And a big thank you to the people of Western New South Wales for coming forward for testing and for vaccination. We hear in wonderful numbers, and particularly young people coming forward, which is terrific. And particularly I encourage people who live in the Bathurst, Parks and Orange areas to please come forward for testing. Thank you.
Good morning. Firstly, can I start by passing on my condolences to those families that lost loved ones overnight. You remain in our thoughts and prayers. As the Premier and Dr Gale touched on, again, the western part of New South Wales and the far west remains an area of concern. In the western New South Wales Local Health District, there were 24 cases, 14 cases in Dubbo, 1 connected to the Coonamble Shire, 6 to Gadooga, and then 1 in Parks, 1 in Mudgee and 1 in Orange. And they are of concern, and again to anybody in that area, if you've got symptoms, please come forward. In the far west, there were only 3 cases overnight, 1 in Wilcannia and 2 in Broken Hill. But in saying that, those numbers may sound better, that we already know since the reporting period of 8 p.m. last night, there are still 15 more cases this morning in the far west. So if you've travelled to Wilcannia or been in Wilcannia in past days, last week, and you're showing even no symptoms, please come forward and get tested. It is very important that we get in front of this, that the testing does give us the opportunity to make sure that we know exactly what's happening in the region. In the Hunter, New England local health district, 2 cases overnight, one in Lake Macquarie, and that was linked to the what we call the Costco cluster, and one in the Cessnock local government area. There's in the Illawarra Shoalhaven area, again 2 cases, this time in the Kiama local government area and one in the Wollongong local government area. On the Central Coast, 2 cases, one that we know about has been in isolation for its whole period, another that's under investigation. As Dr. Gale touched on, our sewage surveillance has led us to finding cases previously. It's one of the most important and positive tools that we use as a government and as a health unit, because often, 9 out of 10 times, it actually does offer up cases. We are concerned through sewage surveillance in places like Galagabone, Canamble, Shell Harbour, but as Dr. Gale touched on, a real focus in Cobar and Baddo Bay. We're also asking for people to come out in big numbers for testing in Cobar, Bathurst, Parkes, Orange and Lithgow. We know we've got cases in those areas, but more importantly, we need to get those testing numbers up, as we know that transmission will be happening across that community. Again, to everybody in the regions, be vigilant. If any signs of illness, please get tested. And of course, let's continue with vaccination. We've got vaccination hubs happening around the state. We've got our pharmacy network, we've got our GP network. In some parts of the state, there is a coordination between New South Wales Health, GPs and pharmacists to have days focused on vaccination. We want to make sure in the regions we remain with the state average in relation to vaccinations. And my message to everybody, don't get caught up in the brand debate. Just book in for a vaccination, regardless which vaccination. They are great vaccinations, safe vaccinations, and for the regional rule in New South Wales, it helps us stop the spread. Thank you.
Good morning, everybody. My name is Neen Ewan and I'm an intensive care specialist at Nepean Hospital, and I've also been involved with the health team in the response to COVID-19. So we've been preparing for the last 18 months, almost 20 months. So I started in March of 2020 when we were called to action, and worked part of this whole team to get our intensive care units ready with our clinicians and equipment. We have the equipment ready. We have our staff ready, and our staff have been meeting every week whereby they share insights. And our Sydney-based doctors and nurses are also helping the rural and regional New South Wales team. We're really fortunate to work in a health system that's well coordinated and resilient, and it's world class. But what's worried us over the last few weeks is the increasing number of patients who are admitted to intensive care, and they're younger, they're staying in intensive care for longer, and they are needing care that can't be provided anywhere else in the wards. There are those who are on breathing machines and on heart-lung machines. And what has really worried us is the number of young patients who are coming in. So up to 25% of them have been less than 40 years old. Our nurses and doctors provide the best and compassionate care, and we need your help. So we know that it's difficult at the moment. We know that it's hard that your families don't get to come in and see your loved ones in the intensive care. So when Dr. Gale talks to the 100 patients with COVID who are in intensive care units, there are another 400 who are in there for non-COVID reasons. And at the moment, you can't go in to visit them. Our nurses, who are the backbone of our healthcare system, are providing care that's compassionate. They're holding their hands and they're comforting them, because we know that you can't be there. And this makes it really hard for the community, and it makes it hard for our nursing and our medical staff across the whole hospital. We are worried about the increasing number of patients who are admitted to the wards, because we know that at some stage they will need the care of the intensive care team. It's not a good day when you have to meet the intensive care team. Okay? We would much prefer not to ever meet you and your families. Our nurses are coming, and our doctors are coming up to work every day, despite knowing how difficult it is. They're leaving children just like you at home, and our call is to please get vaccinated. We know that vaccination decreases your risk of getting severe disease. We know that vaccination decreases your chance of death. And we're here to call to ask you to help us. Our nurses and doctors are committed to providing care, and care in times of normal times, let alone the pandemic. And we really are genuinely asking for your help. So although I stand here as a representative of the intensive care community across New South Wales, I'm going to send out a personal message to those in the southwestern and western Sydney. I grew up in Liverpool and I now live in the Penrith LGA. So please, if you're able and you're between 16 and 39 years old, book in and get your first shot in the vaccine, because we know that it will protect you. And as I said, it's a good day when you don't have to meet me or any of my intensive care team. Thanks.
I always do this to you. I don't understand. May we ask you, of the people that you see in intensive care, do you find that people are expressing regret that they haven't got their vaccination yet? Or some of them, obviously being very young, may not have had access to it for a very long time and thought, oh, I'll just wait. Have you heard stories like that?
Look, I think that everyone underestimates when they actually get COVID. I didn't think it would happen to them. Okay, there are patients who were going about doing their own, going to work and doing essential activities. I think what's devastating is that the transmission through families is very unlike Alpha and last year. So last year we would have a family member have 30% transmission in their families, it's now 100%. So what you end up having is you have families who you may have the wife in one hospital and the husband in another, and then their parents in a different hospital again. And then we've got the layer of having their children who might also be infected. So we know that although at the moment there aren't very many kids or children in intensive care in Sydney, that many of them are being looked after by the doctors at the Children's Hospital because their parents have also got the disease.
Sorry. Dr. Chan has made it pretty.
I'm sorry, I can't hear you.
Dr. Chan has made it pretty clear in estimates this morning that vaccinations for.
Sorry, I still can't hear you, Tom. I'm sorry. Yeah.
Dr. Chant's made it pretty clear in estimates this morning that vaccinations are very important for for kids to return to classrooms, and also said that primary school age kids probably aren't going to get vaccinated this year. Does that mean this week you're going to stand up and tell us that primary school age children are not going to return to classrooms this week?
No, look, it's really important for us to make sure we are able to communicate as soon as we can to the public about what school looks like for the rest of the year, and we intend to do that hopefully by the end of this week. But there's no doubt that obviously vaccinating the senior adolescents is key to this, and that's why some weeks ago we started the process of vaccinating high school students in those local government areas of concern. We want to make sure when schools go back it is a safe environment, and it's an opportunity also to stress how much our thoughts are with families who are trying to work, earn a living and homeschool. But obviously we want the process to be safe, and we're looking at all those opportunities. But I'm also looking forward to the advice we receive as to when we do start vaccinating 12 to 15-year-olds and how that works in the transition phase to going back to school. And we're really keen to make sure that all cohorts of people who may get the virus or spread the virus are protected. But it's important to note that it's still adults giving it to kids that's the main way that children are receiving or getting the disease. And it's important for us to make sure we minimise any risk when kids go back to school.
But Premier, given what Dr. Chan said today, why can't you give parents some clarity today so they can plan the rest of the year? It's patently obvious to everyone that children are probably not going back this year.
Well, I think it's really important for us to make sure we've considered all the issues in relation to schools going back, and as soon as we have concrete advice, and that concrete advice hasn't arrived yet, it will be determined by obviously the public health team but also the education team. And so as soon as we get that concrete health advice, of course we'll communicate that, but I haven't received it yet. and well, I should say the government hasn't received it yet. And as soon as we will communicate that. That's why we wanted to provide certainty for September. So obviously September doesn't change for what's happening to schools, but in terms of when schools are likely to go back, we will provide that information as soon as it's made available. But I think everybody would understand it wouldn't be appropriate for us to speak before we get the formal advice and to speak before we have a plan in place.
Hopefully this week. Are you going to give that advice out this week to parents?
Look, our intention is to provide advice later this week, towards the end of the week, on both what we can do at the 6 million jabs, which
6 million jabs tomorrow.
Exactly. So we'd always said that we will provide advice towards the end of August as to what's possible in September and October, and we're sticking to that. I want to make sure that very clear, that towards the end of this week, people will know if they're fully vaccinated what they can do in September and October. But also, we will give clear guidance on what is a likely timing for schools going back. And please know that our health experts in particular are working on how the HSC can be done safely, working on what cohorts of children it's safe to go back at particular times. So all that detail is being worked through, and I think the community appreciates that they'd much rather have certain advice as opposed to speculation.
There is certainly no indication that children under the age of 12 will be told this week they can be vaccinated anywhere in the world. So given that's the case, can't we provide some certainty for parents with kids in that age group?
Well, we've certainly provided certainty for parents in terms of September, and unfortunately we've said that the current conditions remain in place. So if your children are being homeschooled at the moment, of course that will continue. That's a whole month notice we've given already. But in relation to beyond that, we have to wait for the formal advice. I don't think anybody would appreciate if we just made it up on the spot. We need to get the input from the public health team, we need to get the input from education and get that advice, and once we do, as I said, I'm in all likelihood it will be towards the end of this week. We will be able to convey that.
Premier.
Restrictions on getting freedoms that are linked to vaccine targets. Will it be the same for schools? And what does that mean given that kids can't get vaccinated?
Well, obviously, what's important for us is to make sure that teachers are vaccinated, and that's an added protection for students. And also, we've started the process already of HSC students being vaccinated. So we will provide those plans now that we have some certainty as to what the supply of vaccines looks like in September and October. Obviously, we can present those plans to the community once they're finalised. But again, I don't think it would be appropriate for us as a government to make it up. We have to make sure we get the plans put to us, and of course we'll convey that as soon as we have that.
Can I ask you about Wilcannia?
Sorry, this person.
Minister Hazzard has just said in budget estimates that if a person who had a single buddy lost that person due to the new restrictions, so they're no longer able to see them, they can pick a new person. Is that correct? Do you agree with that?
Look, the Health Minister obviously gets advice directly from the Health Team. If that's the case, that's the case.
Premier, can I ask you about Wilcannia, please? Wilcannia, one of the most remote settlements in New South Wales. We're hearing that tests have not been sent over the weekend because the contractor didn't work weekends. So the numbers we're seeing on Wilcannia are very out of date. There are houses with up to 10 people living in them with infected cases. Can you tell us what you're doing on the ground there? Because it sounds like a mess.
Well, the advice we've had is that all the federal and state government services and community support is working well together, but I will ask either Dr Gall or the Deputy Premier to comment on that.
Yeah, I touched on my numbers earlier. There was only 3 cases in the Far West, but I already know from 8 p.m. last night to this morning there are already 15 new cases that we're concerned about the Far West, and that would include Wilcannia, and it's the way they're uploaded by the provider, and that is of concern. But again, when you say it's a mess out there, it's not. It's a very coordinated whole-of-government approach, including ADF and the Royal Flying Doctors over the weekend. We had a case on a shearing station where 20-plus shearers, and there was a case on site. We were able to mobilise, get resources in, get some food supplies in, and we were able to remove the mum and child that had the mum who had COVID and put them in other isolation. And now, since then, we've been able to coordinate with that particular shearing station. So everything's in coordination. But to your point, it is very remote. These areas are impacted by their remoteness, and what we do is focus whole of government. The issue around testing, those testing numbers come in batches. Are they out of date? No, they're not. They're up to date. as I said, because we get also data since 8 p.m. and we continue to know that in Wilcannia it is a concern, and that's why my call out is, if you live in Wilcannia, if you've visited Wilcannia in past days, please get tested.
Dealing with these tests that doesn't work weekends?
Well, look, I don't have the contractual arrangements, but I know that we use private labs. We are in partnership, and our pathology labs are under stress, and so we do use private providers. What the arrangements with those private providers is one for health, but regardless, the answer is that we get those test results. We've got them overnight. We've got them again this morning, so we know exactly the message today and the concern we have and the focus and priority we've got for Wilcannia.
In regional New South Wales, or is that goal impossible given you can't shut out Sydney-siders from the rest of the state in the long term?
Well, let's have a look at it. There's no jurisdiction in the world that I understand that has been able to get Delta to a zero now, but in the regions we've had some success. When we locked down Orange, with that one example, after 7 days we were able to reopen Orange. Since then we've got cases across the regions, and our hope is that we get on top of it. In the Hunter New England health district, only weeks ago we were reporting 20 plus a day, overnight only a couple. So there is an opportunity that in the regions we can actually get to zero, and that in the regions we can get control. But we've got to be realist and we've got to be real about it, and that is nowhere in the world has anyone been able to pull back Delta once it spreads in the community. That is why the message for regional rural New South Wales, like Sydney, is to get vaccinated, and that's why our focus and our resources are around vaccination in the regions, as we hear in Sydney.
Deputy Commissioner. Yes.
Good morning. Blacktown Church service last night. 60 parishioners. They've come from all over Sydney. Pastors said to them that in the name of Jesus, lockdowns are over in the cities in New South Wales. What sort of message does that send? What's your reaction to that?
Yeah, look, I'm not sure that I need to comment about what the pastor said. What we do know is that Commissioner Fuller has made it very clear that this last week Operation Stay at Home is in full swing right across the state. Nearly 7,000 penalty infringement notices issued. Just in the last 24 hours, 590 penalty infringement notices issued. A very disappointing event, and would anger no doubt a lot of people around the meeting that happened at Blacktown. Regardless, whether it's a soccer match, whether it's a church service, it doesn't matter. You cannot gather as they did at Blacktown. Those people have been issued with infringement notices, and my message would be, I really do hope that they're now reflecting on not just the pastor but the people that attended, reflecting on what they actually did, the risk that they put themselves, their children who were there, their families and their community at. I would hope that that would be the very last time that we see that sort of activity from that group of people. In terms of the Maroubra Party, no. There's an investigation underway as we speak, and I have no doubt in the fullness of time when we actually fulfil that investigation commitment, there will be penalty infringement notices issued. We've been down this track before with various other events. New South Wales helped do their bit in terms of contact tracing, and police will wait for the right time to become involved.
What do you make of
Anthony Curran? Just very quickly, police were searching over the weekend for that the man Anthony Curran. Yeah. How is the search going for him? And I understand he was offering to hand himself in but may have reneged. Is that what's happened there?
Yeah, there's extensive police taskings around this gentleman. Clearly we would like him to come forward and hand himself in. There was some suggestion that was going to happen. It didn't for whatever reason, but we're asking for people, if they know where Mr Crown is, that they should ring Crime Stoppers, 1800 333 000. This man should not be out walking around or socialising in the community. We really need that person to come forward, and we're asking him to do that right now.
The domestic violence services in the Illawarra are concerned that because the regional Greater Sydney barrier has now been put through between Wollongong and Shell Harbour, that's an extra barrier for women trying to flee violence. What are police doing to ensure that those women can get out safely?
Each of our police area commands and our police districts have really good resources in terms of government, non-government and police officers around domestic violence to support victims. I have seen on an ongoing basis information out there that really tells victims of domestic violence to come forward, to allow those agencies that they're normally with and or police to make sure that they get out of those sorts of situations.
What will it take for places, LGAs like Burwood and Strathfield, to be lifted out of the 12? I think Burwood's had 23 cases in the past 4 weeks. Inner West right alongside has had 110, and obviously people are getting pretty frustrated.
Yes, thank you. As we've said, the vast majority of cases that we are seeing come through every day do come from those 12 LGAs of concern. And we know that as well, having said that, people do travel, they still do move, often as authorised workers or for other reasons. And so that risk of seeding in other parts of the city remains. And so we have a high level of vigilance, particularly for those areas that border the suburbs that we're most concerned around at the moment, such as those in the Cumberland LGA around Blacktown. So that risk, while it's concentrated in those areas at the moment, certainly it's broader in those 12 LGAs just because of that geographical proximity as well as the links between different social groups. So we need to have a high level of concern, a high level of vigilance across all those 12 LGAs in particular, but clearly more broadly in the Greater Sydney area and even the regions, as we've heard. It's very easy for seeding events to occur. It's very easy for transmission to occur once Delta gets into a community. And that's just the reality of what we're facing with how transmissible this Delta variant is. And that's why we can't leave it any opportunity to spread. It's why we have to be, as a community, across health services, across industry, across all partners, so careful to follow the public health orders, to minimise any movement, to get tested as soon as possible and to get vaccinated, because this Delta virus is so transmissible. Even though it's concentrated in certain areas, that risk is diffuse. And that's why we absolutely have to focus our efforts at this current time to get that R effective below 1 and stop the growth of this epidemic.
You're not considering any imminent changes to those that would affect those areas?
At this stage, the rules apply to those 12 LGAs and to Greater Sydney and the rest of New South Wales. Because it's our absolute focus at the moment, we need to get the case numbers down.
Dr. Gale.
Once the Central Coast is reclassified as regional New South Wales, Central Coast has more active cases than Wollongong, more commuter traffic and is closer than Wollongong. What was the health advice to let Central Coast be considered regional but not Wollongong?
Yes, look, thank you. As I said before, it's always going to be a challenge about where you draw the line. The risk of transmission is always there, and the basic message for everybody, whether you're in Greater Sydney or whether you're in the regional areas, please follow the advice that applies to you. It's really important that people stay home unless you have a reasonable excuse to get vaccinated and get tested. I can't stress it enough. They are the simple messages. They are what we have been saying all along. And that's really what we need across all of New South Wales. If everyone follows that advice, we have a good chance of driving these numbers down and getting our vaccination rates up. And I really want to thank everybody who's come forward for vaccination to date. And for those people in those 12 LGAs between the ages of 16 and 39, if you haven't booked in already, I can't stress enough from a health perspective how much we really want you to book in and get your vaccination as soon as you can.
Doctor, the 3 LGAs.
Dr. Gale, children under 10, obviously hundreds have contracted COVID in the last few days. How many are sick? How many are in hospital or any in ICU, given your update?
Oh yes, thank you. I don't have those exact numbers, but I'm happy to provide those to you. Clearly in this Delta outbreak, we are seeing increased numbers of children affected. As the Premier said, it spreads easily between households. Once it's introduced into a household, that spreads quickly. We know that particularly in the areas of Western Sydney and Southwest Sydney, we have large families, and as a result, high numbers of children are becoming infected. As we have spoken about previously, also in early childhood settings, we are seeing transmission occur, and that's why we encourage people, recognising that it is difficult and different people's circumstances may not allow it, but to please keep your children home from early childhood settings if you can. So clearly we are concerned around the transmission in children. We are seeing children in hospital, but their rates of hospitalisation and their rates of ICU admission are much less than, thankfully, than what we're seeing in our older population. And I think that's reflected in what we report to you daily around ICU admissions, and also sadly the deaths, which are still occurring in the main amongst people who are older and who often have underlying comorbidities.
Over the weekend, anyone in the 16 to 39 age group can now book in to get Pfizer. Given New South Wales have been doing so well with the rollout of AstraZeneca, are you now concerned that people will cancel their AstraZeneca jabs and wait several weeks to book in for Pfizer?
No, we're really urging everybody to come forward and get vaccinated. Whatever vaccine you can get your hands on, please come forward and get vaccinated. And that's really our strong message now. And we know that the effects of the jab, the first jab, don't happen or set in until 2 or 3 weeks after you get your first jab. So we know that when we're vaccinating hundreds and thousands of people every single week, that within 2 or 3 weeks, those people will be less transmissible, less likely to end up in hospital and less likely to get COVID. So we're just encouraging everybody to come forward and get the jab, but specifically, we are giving priority to people in those 12 local government areas in terms of vaccination. So if you are, again, I know we've said this a number of times, but it's so important to have 16 to 39-year-olds in those local government areas of concern come forward and book. Most people will get the jab within days of booking, within days. And we just urge everybody to do that. It's so important. So we are providing priority in those local government areas to those younger cohorts. But obviously, we're just asking everybody across the state, in the regions, in other parts of Sydney, to come forward and get the jab. If you have any issues or concerns, speak to your GP or a medical professional. But it stands to reason that people are coming forward and putting their arms up, and we're so grateful for that. This is what will get us out of our situation, getting those vaccination rates up. And I was really pleased to hear the Prime Minister's comments, as well as other leaders tempering their comments, because we do need to live with Delta. And that's apparent and obvious. Every state will go through this in different stages. Every state will have a different time when they have to transition. But I just say to everybody across the nation that we are going to go through, each state will go through a difficult time as a transition. Normalising is a word that's probably a bit confronting for people. But just as we tend to talk about the number of people that die from the flu, when we have 80% double dose vaccination, that's how we'll be treating COVID. The case numbers will be less relevant. What will be more relevant is how many people we have in intensive care and how many people unfortunately succumb. But what is really important is for us, if we can get those vaccination rates higher than what we anticipate the timeframes, well, that's great news. And the fact that we got to 6 million jabs, I think when I first announced it, people thought it was unattainable, it was aspirational. But I believe in our people, I believe in the citizens of this state, and no matter how they feel about us, or no matter how they feel about the situation, they know when there's a job to be done, they'll do it.
Premier, are you advised about, when you're making your decisions, are you advised about countries like Israel, where their rate is something like 78 to 80%, but hospitalisations are now going up again, so they haven't actually, they've had to go back in restrictions. Does that play a part in your thinking?
Well, no, we know that the vaccines that we have are extremely effective in reducing transmission, in reducing hospitalisation and reducing death. And we know that's the case. And that's why it's really important for us to get up to those dosages, those 70% and 80% targets. But we also have to accept that we will see more cases, but we'll see less people per population ending up in intensive care. And if you look at a lot of places around the world, whether it's the UK or some states in the US, every state's doing a bit of a different thing in the US, but in the UK in particular, case numbers are going up, but hospitalisations are going down because they've hit their vaccination targets. We're just going to have to accept, and it's confronting for us in Australia, because until this point in time, we didn't have to deal with larger case numbers. We were in a situation where the previous strains of COVID we were able to manage. But what is, I think, interesting and telling is that last year when Victoria went through their very difficult period, the death rate was much higher because the vaccine wasn't available. And we now see the power of the vaccine. And that's why I just urge people not to have the roller coaster of emotions of case numbers every day. It's so easy to go up and down depending on how the case numbers are going. But what is really important for us is to focus on getting those vaccine numbers up. And I just, again, thank the Prime Minister for his comments over the weekend and today. And I also acknowledge that every state is going to have to go through this transition one way or another, because once you open your borders, we can't live in isolation forever. We're one of the few nations on the planet that is still living in isolation. But once you start opening your borders, every state's going to see case numbers. And that's why we just have to get used to the fact that our aim during the pandemic is to keep people safe and healthy, keep them out of hospital, but trying to get to a normal life as soon as we can.
But Premier, is there a number in the hospital system that we can't get to? The cases going up, that puts pressure, until 80% of us are vaccinated, that puts pressure increasingly on the hospitals. Hospitalisations now hitting 100 in ICU today. What is the number with cases going up that we can't go past, or the hospital system?
Well, there's never a situation that we can't manage in New South Wales, but it's a question of how we're stretched. And as Dr Nguyen said from the Nepean Hospital, our system's been preparing for this for more than a year and a half. We have what's needed to protect our citizens, to keep them safe, to keep them healthy, but this is where we need the community's help in getting vaccinated. We can't do it on our own. The higher vaccination rates will put less people in hospital, will prevent families from succumbing. And as Dr Nguyen said, what breaks our heart is because the high transmissibility of Delta, once it gets into a household, everybody's getting it. If the household's not vaccinated, if the adults aren't vaccinated in that household, everybody in that household is getting it. And when you have, in some situation, multiple generations living in the one home, you're seeing everybody who's not vaccinated succumb. And that's why we really urge the community to work with us as you have been. And the community's been outstanding. I mean, the case numbers compared to what other states per population are doing in New South Wales is just outstanding. And the number of people coming forward and getting vaccinated is outstanding. And when I looked at figures over the weekend showing that New South Wales has some of the highest vaccination rates in the world, not just Australia, that's something we can actually cling on to and be proud of. But that is why we need to work together, because we can do everything we can to support people when they end up in hospital, to make sure our staff are just working around the clock as they are, whether it's in the frontline health services, whether it's in the back office, whether it's our public health team, our contact tracers. Everybody's doing their bit, and and we know the public's doing their bit too by coming forward and getting vaccinated.
Premier, is there a plan to pass?
Will you commit to having a similar inquiry into this outbreak once, obviously, it can be done?
I have no issue whatsoever with as many inquiries as people would like to have. But can I just say, let us get our job done in this instance. Let us focus on what we need to get our community through these challenging times. And all of us should be held to account. But also we need to have realistic expectations. Please point to one nation or state in the world that hasn't had thousands of cases because of Delta. Please show me the perfect state or the perfect nation. What we do need to do is make sure we keep our residents safe and healthy, but also accept that a pandemic means that all of us are impacted. And Australia, to this point in time, has done unbelievably well. But we're not in isolation. We can't pretend we're different to anywhere else in the world. But we have been, to this point in time, successful in not having the thousands and thousands and thousands of cases a day. And it is a race against time. We want to make sure the vaccination rates go up. And case numbers stay relatively stable or come down. In some countries, you know how we talked about the 1.3 are effective last week. In most countries, it's around 8 or 9. So the fact that we've been able to keep it down, and we want to see it go below 1, don't get me wrong, that's our intent. But in most nations around the world, it hovers around 5 to 9. So whilst people are concerned with what's happening here, and I get it, it is really important for us to focus on what we need to do to live life freely and safely, and also to accept the reality of Delta. We can't pretend we're somehow extremely special from everywhere else on the world, and we can't pretend that any amount of lockdown alone is going to help the situation. The vaccinations are key. We've been saying that from the outset. We said it months ago, and that's why we're really racing against time to get those vaccine rates up. whilst we're dealing with the current outbreak. And of course we want to see those case numbers go down, but for us the more important figure is getting those vaccination rates up and not going through the emotional roller coaster every day, because once we get to 70%, the Doherty report says you enter a period of transition. The Doherty report recommends you don't even talk about cases, you focus on people in hospital and the vaccination rates, which is what matters. And that's what we'll be doing according to the national plan that every single state has signed up to.
Premier, given the sacrifices everybody's making at the moment, particularly in the 12 LGAs, what do you make of last night's church service and what happened there?
Oh look, it's very disheartening, and I think all of us feel the disappointment when people just blatantly ignore what's in place. And we know it's hard. We know the pressure we're putting on families and households, and you know, who would have imagined, in whose world would any of us have imagined that would be in this circumstance? And I'm hoping that obviously in the near future we'll be able to relieve the stress on families and households. But it's always disheartening and disappointing when you see people blatantly take it upon themselves to contradict what we know works, to contradict what we know is keeping people out of hospital. And that's the key, to keep people out of hospital, to make sure that we keep people as safe and as healthy as possible. And we know the vaccine is having such a huge impact on that, and that's why we joined Dr. Nguyen and all the frontline workers across our health system in getting those vaccination rates up.
Is there a plan to fast-track vaccinations for regional Year 12 students like we did in South West Sydney, especially in Western New South Wales, so those kids can sit their HSC?
Well, look, we're going through those plans at the moment, but it's important to note that density spreads the virus more quickly. There are certain parts of the state which are more susceptible in terms of how quickly the virus is spreading, and all of that is taken into account when we look at our plans moving forward. We're looking forward to conveying to the community what going back to school might look like in the near future and giving parents that certainty, but that's why we were very keen to make sure, as soon as we knew last week that schools wouldn't be going back in September, that we announced that, to give parents that certainty to make arrangements as they see fit. And again, every day I struggle to think what it would be like to have to work and homeschool and supervise, and especially for single parent families, which there are a lot of. And I can't imagine how stressful and difficult that is. But I also appreciate that what is really important for us is the safety and well-being of our children. And children are resilient. Everybody around the world and everybody around Australia is or will go through the same challenges at some stage, and it's important for us to keep everybody's mental health as strong as possible, as well as the knowledge that we're doing so well with the vaccination rates. We're exceeding our expectations, and again, when I set the 6 million target, a lot of people scoffed that we wouldn't get there by the end of August, and now we're a week ahead of schedule. And I'm hoping people will scoff again when we get to those 70% double dose earlier than the end of October. If we keep working the way we are, we'll get to that target ahead of the end of October. But it all depends on us continuing to keep that up. And some countries, for example, have noticed a slight pause when the population gets to 60% double doses. It's harder to get from 60 to 70, but I don't have those concerns here in New South Wales. I think we'll get to the 70% as quickly as we can get, and then get to that wonderful 80% where life can go back to pre-outbreak as closely as possible, and where all of us can put these really difficult times behind us.
Premier, what are you doing about
just on the reclassification of New South Wales? An open letter has been written by Illawarra politicians. We have 3 from state, 2 from federal, and even an Australian senator calling for you to reassess the decision for Wollongong to be considered Greater Sydney. Is that something you're weighing up?
Well, I appreciate everybody wants to have a say in how we classify and how we move forward, but that's really based on the health advice we have and all the other considerations we need to take. It's based on geography and people's movements and what the authorised workers are doing. So there's a whole range of issues, and I appreciate some communities in the regions are still saying we have no cases, why are we in a lockdown? But I think everybody understands the gravity of the situation now. It is a race for us to get those vaccine rates up. So as stable and as low as we can get those case numbers whilst we're racing to get the vaccination rates up. is the strategy we need to keep adopting, and that's why I think everybody understands that. And every day, a day doesn't go by when we don't think about the stress that's being placed on individuals and families, and also appreciate that everybody has an opinion. There are 8 million citizens, and I'm sure everybody has an opinion of how things should happen or what's occurred, and that's a matter for everybody to assess themselves. What we do as a government is look around the world, look at what our best experts in New South Wales are advising us, and also what the National Plan says. And New South Wales was the first to enthusiastically endorse what was in the Doherty report, even before this outbreak, because we appreciate, or even just at the early stages of this outbreak, because we appreciate that vaccination is our best weapon against COVID and living with Delta. And we need to learn from what's happened overseas, but we're from a different position. Other countries didn't have the benefit of having a relatively, especially in New South Wales, having a relatively good 18 months compared to the rest of the world. And now we are facing what every other jurisdiction has faced, and that's confronting. But that's okay, because every state in Australia is going to have to go through this eventually, because eventually borders are going to have to come down, and it's up to obviously how each Premier responds to the National Plan. But whenever the borders come down, Delta is going to be part of the community.
Premier.
Is in Central Coast.
In September, I didn't see that. I must have missed it. Are you saying today now that term 3 there's no chance of face-to-face?
Well, we'll obviously by the end of this week convey what our plan for schools is, but we were very clear to say that the lockdown in those parts of Greater Sydney was extending till the end of September, so we were very clear about that. But I did say that we would talk about what's happening in schools towards the end of this week, and that remains the case.
Premier, can I just ask you again about...
one there and then one there, yeah.
Regional hospitals. You say our hospital system can cope when we allow the virus to run, but a lot of regional areas don't even have, remote areas have a healthcare centre. That's all, no doctors, there are very few specialists, even in large-ish regional towns. What contingency planning are you doing for those areas?
Well, that's why it's really important for us to make sure the high vaccination rates are everywhere in New South Wales, because we know that the regions have been responding to the vaccination. We've seen regional communities really come forward and get vaccinated. The challenge for us is to make sure the points of access are clear, because some people do live very remotely. Some people do have obviously greater challenges in getting to their closest GP or pharmacist or healthcare clinic. So it's really important for us to move together, which is why we have postcode by postcode real-time information, encouraging communities to come forward and get vaccinated. And there are contingencies in place for supporting people who get the virus and who are ill and need to be hospitalised. But our biggest weapon across anywhere in New South Wales, it doesn't matter what your postcode is or what your circumstances, is getting vaccinated. And we know that in some communities that there wasn't that sense that they needed to. And why would you blame them until this point, when they'd had 0 cases, lived hundreds of kilometres away from any centre point or any centre of COVID? There was that level of perhaps not needing to get vaccinated, and that's why obviously things have changed in New South Wales, things have changed in regional New South Wales, and our public health officials are in contact, as Dr Nguyen suggested, all across the state. We're using experts from all parts of New South Wales to support our communities and all government agencies. And again, we say that the advice doesn't change no matter where you live. Get vaccinated.
Of other states as to what happens at 70 or 80%. Do you accept some responsibility for that occurring and a potential, fracturing of national cabinet agreements? Because what they're nervous about is the outbreak that occurred in your state.
Oh, look, that's for other states to assess, but New South Wales is the largest, most densely populated state in Australia. And we have to accept that the challenges we face here are very different from what happens in Tasmania and even WA, which is a more isolated state. We can't pretend that every state is exactly the same in Australia in terms of population and density and risks. And that's why we do need to work together as a nation. We do need to make sure that we're supporting all of our citizens. Many citizens have relatives across the nation. Many of our citizens still want to come home. Many of our citizens want to go overseas. So these are all challenges we accept as a nation, but we also have to understand that every state has different challenges, and certainly Sydney and Melbourne are highly populated. We'd argue that Sydney is the gateway to Australia, a densely populated global city. and Melbourne in similar circumstances. So what we're experiencing is very different to what other states will go through. But at the same time, we have to accept that we are a nation, and we can't pretend that what happens in New South Wales or to a lesser extent in Victoria is going to be exactly the way that occurs in other states. But it doesn't mean we don't work together as a nation. It doesn't mean we accept those challenges, and it doesn't mean we don't ensure that we all get vaccinated, that we all open up, and we all allow our citizens to live as safely and as freely as possible.
Just back on regional hospitals.
Last question. Yeah.
Just back on regional hospitals, what is the capacity looking like in the ICUs in regional hospitals, including Wollongong, obviously now that South West Sydney patients are still being taken down there?
I don't know if Dr Nguyen wants to comment on that. I'll give Dr Nguyen the last say, and I'll see you all tomorrow. Thank you.
So thank you. Look, in regards to regional New South Wales, and we are aware that there are a lot of pressures, and the resilience and capacity is not the same as it is in Sydney. But what we are very fortunate in is that we've got a really well-connected system. And in fact, with the age of COVID and telehealth and the ability to zoom in and talk to our colleagues to provide support, I think has really set the scene for us, and we're very well prepared. So I think have some comfort in knowing that we understand that the regions will be stretched, and we're ready to help in any way we can. And certainly from thinking about Wollongong, very different Dubbo, but Wollongong, we're aware of that southwestern sort of corner where there will be patients who've been transferred to Wollongong to help southwestern Sydney. So I think that, overwhelmingly, and I'm really proud to have been involved in the efforts of a well-connected community of intensive care, doctors and nurses, and we are all supporting each other.
Thanks everybody, that was it. Thank you.